All right, welcome to The Explainer. Today we're diving into something that, believe it or not, can start in a pretty surprising place but end up as a really serious, life-threatening condition. We're talking about a lung abscess, so let's jump right in.
So, our story kicks off with a real medical mystery. You've got this 50-year-old guy who comes in with a pretty nasty cough. But listen to the clues here. He says he's coughing up a lot of stuff, it smells really foul, and, this is the kicker, it gets way worse when he lies on his left side. Yeah, this is definitely not your average cold. That last bit about his position changing things, that's a massive clue. So you gotta ask, what in the world is going on inside his lungs? These symptoms are screaming that something is pooling up inside his lung and then literally draining out when he moves. It's a pretty clear signpost pointing us right to the diagnosis.
And the answer is a lung abscess. And yeah, it is just as serious as it sounds. So let's really unpack what's going on deep inside the lung. Okay, so what is a lung abscess? Think of it like this. It's the body's desperate attempt to wall off a disaster zone. An infection gets so out of control that parts of the lung tissue actually start to die off. That's what necrosis is. So to try and contain the damage and stop it from spreading, the body literally builds a wall around this dead, infected tissue. What you're left with is this nasty, walled-off cavity, just filled with pus and debris.
But how does something like this even form? Well, believe it or not, it almost always starts with something called aspiration. That's a fancy way of saying you accidentally breathe in bacteria, usually from your own mouth. Once those bacteria get down into the lungs, they set up shop, the infection kicks off, and your body's defenses go haywire, which actually damages the lung tissue. And the final step, the body throws up that wall we talked about, sealing off the infection and creating that abscess cavity.
Okay, but wait a minute. Why would anyone just breathe bacteria into their lungs? It's a good question, because this doesn't just happen to everybody. You have to be pretty vulnerable, and there are some very specific things that put you at risk.
And this is where the story gets really interesting. A lung abscess is almost never just a case of bad luck. It's usually a sign that the body's defenses are down. Think about it. Things like heavy alcohol use, being under anesthesia, or even a head injury can weaken your gag reflex. That makes it way easier for stuff from your mouth to slide down into your lungs. And here's the real kicker. Something as simple as poor oral hygiene or bad cavities can turn your mouth into the perfect breeding ground for the exact kind of bacteria that love to cause these abscesses.
Now, let's talk about the culprits themselves, the bacteria. They basically come in two flavors. On one side, you've got the anaerobes. These are the tough guys that don't need oxygen to survive. They thrive in places like infected gums. On the other side, you've got the aerobes, like your classic staph or strep. They do need oxygen, and they can cause some really nasty infections too.
All right, so the doctor has a suspicion. How do they actually crack the case and confirm it? Well, they've got a whole diagnostic toolkit they can use, combining what they find in a physical exam with some high-tech imaging.
During the physical exam, a few key clues can pop up. A high-grade fever with chills? That's pretty common. Then there's something called clubbing of the fingers, where the nail beds get all swollen. It's a classic sign of chronic low oxygen. But the really telling part is when they listen to the chest with a stethoscope. They might hear these really weird cavernous breath sounds. It's a hollow echoing sound that basically screams, "There's a cavity in here." But the real smoking gun? The thing that confirms it beyond a shadow of a doubt? That's the chest X-ray. On the film, you'll see it clear as day, a distinct cavity. And the most crucial part is something called an air fluid level. Just picture a water bottle lying on its side, half full. You see that perfectly straight line where the water meets the air? That's exactly what doctors see in the lung. The pus and debris settle at the bottom and the air floats on top. It's an absolutely unmistakable sign. So, the diagnosis is in. Now the fight really begins. The game plan is simple but tough. You have to completely wipe out the infection, get all that nasty stuff drained out of the abscess, and give the lung a chance to heal. And the #1 weapon in this fight? It's a long, rigorous course of really powerful antibiotics. You have to remember, this infection is hiding out inside its own little fortress. That walled-off cavity protects it, so you need a serious, sustained assault to break through and kill everything inside. And I'm not kidding when I say long. We're talking 6 to 8 weeks. Think about that. That is a huge commitment. It just goes to show you how dug in this infection is and why it's absolutely critical to finish the entire course to make sure it doesn't just come roaring back. But it's not always just about the antibiotics. The best approach is often a three-pronged attack. First, you hit it hard with intravenous antibiotics.
Then, you bring in physiotherapy, something called postural drainage, which uses gravity to help clear all the gunk out of that cavity. And for the really stubborn chronic cases that just won't clear up, sometimes surgery is the only option left, to actually go in and remove the damaged part of the lung. Which brings us full circle, right back to that 50-year-old man and his terrible cough. You see how it all connects? What likely started as a simple issue in his mouth, maybe some bad gums, a tooth infection, spiraled into a life-threatening abscess in his lung. It's such a powerful reminder, isn't it? That something as basic as oral hygiene, as simple as caring for our teeth and gums, can have a huge impact on our entire body, especially when we're talking about protecting the most vulnerable people. It really makes you think about how all these seemingly small things are connected, and how sometimes they matter the most.